Let's have a look to the mobilization of the clavicular bone and the clavicular articulation. We have the two of them. One is sternoclavicular joint. A very simple and effective mobilization technique is this one. Proximally to the joint, I grasp clavicle bone and I move it in this plane towards the neck and down. To feel better the movement, I can accompany the movement with my fingers straight on the joint line. The second technique, I grasp behind the clavicle bone. If this is the bone, like this, I really grasp it as if it would be a piece of wood. I hold the sternum and I pull it up towards me. This is a distraction technique. I practice a very gentle, soft grasp behind the clavicle bone so that I'm not irritating the scalene muscle and the plexus. The third technique, I'm pushing here from the acromioclavicular joint towards sternoclavicular joint. I move it forward and backward. My hands, they do this. To prepare these techniques, we can do some soft tissue massage, soft tissue treatment around the joint, easing tightness of the tissue of the joint capsule and the ligaments just around the sternoclavicular joint. Let's have a look at the acromioclavicular joint. The clavicle bone is ending here in the acromioclavicular joint region. So I'm holding the acromion here, the upper part of the shoulder, on the back and on the front. And I'm pulling the clavicle forward and backward. So with my right hand I'm fixing the shoulder blade and with the left hand I'm mobilizing clavicular bone. It is an anterior-posterior movement. Then the same, I'm grasping behind and I'm pulling it in this direction here. It is not so easy as we can do it in the sternoclavicular joint, but we can do a little bit of distraction. And then we have the same movement. I'm pushing from sternoclavicular part towards acromion and back. It is a non-specific movement. Soft tissue treatment around the joint, in particular on the lateral side. There we have a ligament which is fixing the bone to the scapula. Deep transverse friction on the lateral side.